All right, I think that we are in a very good place to start this presentation. Welcome, everyone. The Alliance of Community Health Plans and Clarity Solutions are pleased to present this online educational program. We are excited that you are joining us as we discuss the available resources to best support your beneficiaries. My name is Maria Velasco, and I am a CHP Associate Director of Strategic Partnerships. This presentation will last up to 50 minutes and includes a specific question and answer periods at the end of the presentation. To submit a question at any time, please use the chat box and we will address your question at one point. If you want to contribute to the discussion verbally, please raise your virtual hand and I will unmute you as I am your technical moderator to this presentation. During this webinar, Eileen Cianciolo, Chief Product and Innovation Officer from Clarity Solutions, by the way, one of ACHP corporate members and a partner of the association at the highest level, will explain CMS's new requirements related to utilization management, along with thoughtful ways to effectively and efficiently meet these new compliance requirements. And without further ado, it is my pleasure to introduce you to Eileen. Eileen Cianciolo is a healthcare industry veteran with over 25 years of experience in care management, engagement, and analytics. Eileen, the floor is yours.
Wonderful. Thank you so much, Maria, and good afternoon, everyone. Thank you for your time this afternoon to just chat around some of the new requirements from CMS. So if we go to the next slide, we'll just go ahead and just jump in. And as Maria just described, my name is Eileen Cianciolo. I'm the Chief Product and Innovation Officer here at Clarity Software Solutions. I have been in the healthcare industry. I just leave it at 25 plus years, and with extensive experience in member engagement and care management, analytics, anywhere from Blue Cross Blue Shield through to various different analytics and AI companies and member engagement companies. So we go ahead and what we're going to cover today, we're just going to spend a little bit of time talking about this, breaking down some of the CMS changes, both for utilization management that are coming here in 2026 as well as in 2027. And then we're going to spend a little time overviewing and just sort of an introduction of the mid-year enrollee notification of unused supplemental benefits changes. I know that is a mouthful. I know in healthcare we have so many acronyms that we don't have one yet for this one, but we definitely need it because it is a mouthful. So we'll spend some time talking about those requirements that are coming up as well. And then some different strategies to effectively and efficiently be able to meet these requirements. So as we go forward, I'm going to just give a quick overview as far as who Clarity Software Solutions is. I'm sure that many of you have probably heard of us. We do business with over 100 plus healthcare clients across the country, from the regionals to the large nationals. And we touch over 143 million lives across the United States. And we've really emphasized that we are the one-stop platform for healthcare engagement, founded in 2007 in Madison, Connecticut. And here's just a small representation of some of our very important clients that we have. So just what does Clarity Software Solutions do? What are some of our core solutions? Again, the platform is the foundation of what we offer, and then have many different really different solutions on top of it. So everywhere from everything on member onboarding, so all of the ID cards, digital wallets, something new that we've just recently launched. We do any kind of welcome letters, member guides, member kits from a payment perspective and post claims. We do EOBs, EOPs, as well as checks and payments. And from a regulatory perspective, we handle 1095s, your annual notice of changes, your ANOCs, your SBCs, and utilization management, which we're going to spend some more time talking about today. The M3P, which is another compliance requirement, which I'm sure you're all very well aware of. And then multiple different correspondence, whether it's letters, invoices, notices, emails, texts. So really a platform to be able to support this core engagement needs across the board. So as we go on to the next slide, just a little bit about us. While we do have a very strong digital capability and presence, every single thing that we render, we then can distribute it, whether it's via email or text, web services, and we own our own really state-of-the-art print production facility that's 76,000 square feet located in Stratford, Connecticut. We focus specifically only on healthcare. And just to give you an idea of some of the volumes from 2024, there was 124 million packages that we sent out with over 698 million impressions, 99.9% delivered on time. And we have a proprietary QA camera-based process that we use throughout the entire end-to-end that helps ensure the accuracy and the on-time delivery. And our something we're very proud of is our over 25% of our staff has a 10+ year tenure, and then multiple different backup contingencies for us as well. So let's move forward and let's delve into the topics that we came here to chat about today. So I don't think any one of you will argue whatsoever with the fact that healthcare is not perfect. We all live and breathe in the industry, and so we know that it's not. And yet we really strive to wanting to improve it and do what we can to improve it. These are just some stats that I found very interesting and I don't know, maybe a challenge for all of us to on how we can improve things. That members, when surveyed, 50% of them, of adults, have difficulty understanding their benefits. Right? And we talk in acronyms. We think that we're being clear. We may understand it well ourselves. However, it's not working all the time. Not a lot of the time. And 4 out of 10 people delay or go without care because of the costs. And I'm sure that that we all know those individuals. It's not just in certain areas. I think this is really happening, especially these days, more and more across the board, where people are putting off their care because of the cost. And then barrier ridden, right? They don't understand their insurance. They have 60% that have experienced a problem with their insurance in the past year. And, for all of us, we've got constant changes and expectations from CMS and different regulatory guidelines that, we're trying to ensure that we're meeting. And sometimes, we lose the individual in that. And yet, it is the most important thing that I know we're all here for is helping to improve individuals' healthcare. So let's talk about the next slide, a few different things that's happening with CMS, right? So just to kind of, and I'm sure you all know this, there's a common thread across CMS requirements is trying to improve the member experience. And now this may add a lot of complexity to our jobs in order to be able to deliver this, but ultimately, it is important to improve that member experience. We know that access to care is critical. So examples such as COVID, where the telehealth was then extended, and now telehealth is a core of what is offered in healthcare. We know the work and the emphasis around health equity and the reporting around that CMS has required. The timeliness of accessible and alternative formats, like being able to offer in Braille, in CDs, and alternate formats of many different languages. So, access to care is something that through the member experience, we can help improve. Transparency, people want to know what they're covered for, what the denial reason is for when they have a care that is denied. Interoperability is critical. And one of the things we'll talk about a little bit here is the requirement around mid-year enrolling notifications of unused supplemental benefits that's coming up next year. And affordability, right, is critical. So, well, that's okay. We can go ahead. So let's talk a little bit about utilization management. Utilization management, not something new, something that we've been doing in healthcare for as long as I've been in healthcare. But there's a lot of room for improvement, and CMS is really ensuring as part of their final rule that was just in January 2024 around the interoperability and prior authorization, that final rule, making sure that we really improve utilization management. It's really designed to be able to improve that exchange of information when an individual is seeking care and whether or not that care is going to be approved or denied. And it really also focuses on the part on the APIs and part on the member experience by enforcing, stricter timeframes that are coming, and increasing the overall transparency of the utilization management process. So who does this final rule impact? Well, quite a few. Medicare Advantage across the board, state Medicaid, the CHIP program, fee-for-service, Medicaid managed care plans, and then QHP as part of the federally facilitated exchanges as well. So quite a few across the board this rule impacts. There's a couple of different pieces of it. The effective date for first piece is January coming up here. I know it seems like it's not really coming up here, but I can't believe it's already the end of April and it'll be here before you know it. So timeframes and denial reasons to providers and patients have to be, as well as publicly accessible reporting metrics, and we'll talk some more about this. And then in January of 2027, there's APIs that are required in order to be able to provide prior authorization information back to both providers as well as to members. So two pieces of the changes that are coming for utilization management, two different timelines that those will go into effect. So, some of the trends and really assumptions is that moving more and more towards the electronic exchange of healthcare information. And so this step with the APIs is really starting to move that forward, as well as really aligning the push for more transparency with members and between the healthcare entities. And probably, I think maybe one of the most important things in here is reducing delays in care. Right. And the numbers that we have as far as estimated utilization management is to save around 15 billion over 10 years. So what are the implications? There are implications for us. There's investments that's going to be required around operational processes and technology required to meet these new requirements, as well as the APIs from a data exchange perspective, faster turnaround times, which we'll talk about, reporting transparency, and measurements. So if we go to the next slide. So what are the changes? Okay. Really draw your attention to the current versus new on the table. So the prior authorization turnaround time requirements are changing. The expedited, as you'll see, are pretty much staying the same at 72 hours, except for Medicaid fee-for-service down at the very bottom, where they had not specified previously what the for expedited, what the turnaround time is, and that is 72 hours now. So the main changes that are coming is in the non-urgent, where you can see on the far left-hand side column where it says standard non-urgent for every single one where there was 14 or 15 calendar days, or for Medicaid fee-for-service not specified, those are all cutting in half. So instead of 14 days down to 7 calendar days, QHP's staying the same at 15 calendar days, and then Medicaid now required at 7 calendar days. So what does this mean? This means that your processes are going to have to change, and the turnaround times, you're going to have to ensure that you have a solution that meets the requirements. And we all know that when the clock starts ticking, right, the last piece of that clock is the actual distribution of the materials. And so being able to have a solution, so for what Clarity offers is a same day SLA, which we are processing files 24/7, 365 days a year. As soon as we get it, we're processing it. That includes holidays and weekends. And so as soon as we get it, we move to production, and we have multiple changes of custody, which is the definition change of custody when when the clock stops ticking. And your timeline is when that change of custody and that timestamp is on those materials. That's when the clock stops. So being able to process those in the same day SLA up until the last change of custody is 11:59 p.m. Eastern time. And so that it's critical, being able to process these regularly as they're received, have a SLA, contracted SLA for that same day workflow, 365 days a year, weekends and holidays. Okay. So if we go on to the next slide, changes as far as provider notice, and including denial reasons. So if this is coming in 2026. So if a member's prior authorization request is denied, that plans will be required to provide a denial reason or reasons to both the provider and the patient. That can be done either via print, it can be through the portal, fax, email, phone, according to that CMS final rule. So currently, there's no uniformity for informing the providers of denial reasons. This new requirement ensures that providers, payers, and patients have access to the same information, and it gives providers the information that's necessary to appeal and recommend an alternative. So that's like, change number 2 that's coming is around provider notification and patient notification. So if we move on to the next slide. Right. So again, it's critical to be able to have a solution that supports multiple different channels and outreaches. So we can take any data that we all, our saying is if you can throw it, we can catch it. To be able to organize, leverage that data, would definitely need obviously the denial reason, contact information, preferred channel that the individuals have opted into, and we can distribute whether it's our state-of-the-art production print facility, email. We are already integrated into the majority of our clients' portals, so it can post to there. We can do text notification and web services. We can render and support that API information and requests through our web services as well. So what's critical too is being able to ensure that the reporting that you get back and the reporting that you have supports that entire timeline. Right? So they've got the audit report for timeline of when something changed custody and that end of the timeline and that timestamp ends. And then find really in our platform, right? So you can access different reports. We can export those reports. We can configure those for you, and then you have those available for up to 2 years. So really being able to support that overall provider notification, member notification, entire flow. So if we go to the next one. So, okay. Now, the final third change for utilization management is around prior authorization metrics, the 2026 changes. So payers, right, are required that are impacted by the new CMS ruling of everyone who is impacted that I walked through earlier. You're going to be required to publicly post prior authorization data on your website so that members can look and can to see all of the different items and services that require prior authorization. But not only that level of detail, but the percentage of standard and expedited prior authorization requests that were approved versus denied, the percentage of standard prior authorization requests that were approved after appeal, percentage of standard and expedited claims where decision timeframes were extended and then followed by a request approval, and then the average and median timeframes between a prior authorization request and a decision for standard and expedited prior authorization requests. So there's a lot of transparency that is being required as part of this, with a lot of data that will need to be pulled and then posted and available publicly on the website. So while these may not seem like huge changes to be ready for these, there's definitely a lot that's involved here. And considering these are 2026 changes, it's something to absolutely be focused on right now. So that we make sure that you have everything that you need, all of the data, all of the reporting, all of the communications in place and ready for January 1st of 2026. So another key is obviously going to be reporting and being able to have the access to the data. And so again, any data that we receive, we can provide back through self-service reporting. We can configure reports based upon your needs. They can be exportable to Excel or CSV. So whatever data we have, we can help to support that. So whether it's the time frame, turnaround times, it's the number of denials and denial reasons, because we have that as part of any of the communications that go out. We're very, very flexible, and have quite a powerful suite of reports that will help to support any of the needs that are required as part of these prior authorization metrics. So if we go to the next slide. So why does all of this matter? Well, it's prior authorizations. It's a fundamental part of healthcare. I think the most important piece in here, we probably all would agree, is the access to care. That behind all of this process, behind all of these notifications, behind all of these rules, there's an individual that's seeking care, that needs care, and we are administering a process to determine whether or not that individual is going to get that care that they're seeking. And so, ensuring that it is the most efficient, transparent, and quick process as possible is what I really think CMS's goal is here in making some of these changes, so that individuals can get the care that they need and have in a timely manner. And to that point, right, just Medicare Advantage insurers made nearly 50 million prior authorization decisions in 2023. That's just an average of 1.5 per Medicare Advantage member, and we know that for some that number is way higher than that 1.5. So it's what we can do to focus on improving this overall process. I had one of our clients feedback that they actually had in a large national health plan that had some care managers in their utilization management department that were working from home, that print out the letters, authorizations by the end of the day, and go to the post office in order to be able to meet the timeline. So it's critical to be as comprehensive across the board with the solution that you have, and be as efficient as you can while getting as quick of a decision to your members as possible. So that's what we've got on prior authorization and utilization management. And now for my favorite mouthful, going into the mid-year enrollee notification of unused supplemental benefits. Now you may say, doesn't go into effect until the middle of 2026. I mean, it's January 26th. The communications have to be sent out between June 30th and July 31st. But I can tell you there's a lot that's needed here, and to think through this process and the data that needs to be pulled in order to be able to solve for this. So if you have not begun solutioning for this to, as quickly as possible, get in place what you need, I would just highly recommend that this is an area of focus, because it will be here before we know it. So what is this mid-year notification of unused supplemental benefits? This applies specifically, exclusively to Medicare Advantage plans. And what's the goal? There are a significant number of supplemental benefits that are added as part of Medicare Advantage plans. Upwards of 23 for some, and almost all of the Medicare Advantage plans have some type of supplemental benefit that is offered. Right? These are benefits that are funded through their US tax dollars, and it's intended to be able to improve the individual's health. And unfortunately, one of the facts is that they are very, very underutilized. And so CMS is requiring for all Medicare Advantage plans that offer supplemental benefits. So those are supplemental benefits, right? Range anything from dental and vision and hearing to meal delivery, transportation, the list goes on and on. They're requiring that a communication has to be sent annually between June 30th and July 31st to members who have completely not used that supplemental benefit. So, for example, if somebody did go to the dentist to get their teeth cleaned, they utilized some of that benefit. So you're not required to report on that one. However, any of the other ones, you've got to be able to pull the data to know that they have the supplemental benefit by member, that there has been zero utilization of that specific supplemental benefit, and that needs to be included on the notification that's sent between June 30th and July 31st. So this really helps to support the initiatives around transparency. It's a benefit that people are notified of, usually at the beginning of the year. They get their member card, they get their member information, benefits are described in there. But again, they go very, very underutilized. So this is a big requirement of being able to pull all of this data and send these letters out for any Medicare Advantage member who has not utilized any of these supplemental benefits. And so, getting on this right now as far as being able to pull the data, and then, finding the right partner to be able to help with the execution of it. So it just really supports the transparency and then helping members to really understand their benefits and how to use them, and just overall aligning with value-based care, really, modeled by really connecting members to the benefits that help them improve their overall health outcome. So what are the implications of this one? I'm sure all of your minds are probably spinning on what this takes. There is a significant operations, and then tech from being able to pull and to access the data is probably going to be the most critical piece of this, of getting that data pulled timely and being able to be handled with be multiple potential different formats for that, and then driving that outreach in a timely manner that happens, again, short time period, June 30th to July 31st, to demonstrate the compliance with it. So pretty big change, and notification that's coming here in 2026. So as we go on to the next slide. So there's not a ton of experience, like requirements around this, like many of you who know about like the M3P, right? CMS was very, very descriptive and prescriptive as far as what the template needs to look like and what information is in it. Not yet for this, and may not. This is a high level, really guidance that they've given. Timeframe's clear. Like I said, June 30th, July 31st has to be sent out. Targets Medicare Advantage members who've completely not used that supplemental benefit after the first 6 months of the year. Right? So you have to pull that data pretty quickly, because you've got 6 months of they haven't used it, but it has to be sent out between June 30th and July 31st. So the time window is very small there. And then if that supplemental benefit is just partially used, you don't have to report on it. It's up to you. You can or can't. But including things, and also channel mix, obviously it's print or digital, but only if that member has opted in for e-delivery. So it's for health plan communications. Then you can send it, we can send it for you, e-delivery. Otherwise, it's got to be print. And then some of the just guidelines of the communication, similar to explanation of coverage. So being able to list those unused supplemental benefits, details around the eligibility criteria and limitation of the benefits, such as like out of pocket and deductible, as well as network, network details, in network versus out of network, and how to access the benefit. And a customer service number for questions. I can be like one customer service across the board, or you may have different ones depending upon what the information is around the supplemental benefits. So, some guidelines definitely to go by, but a little, not a prescriptive template that has to be used, but I'm pretty clear as far as when and what and to who. So as we go to the next slide. So what I really urge all of you to do is don't just check the box on yet another communication that has to go out to individuals and to your members. Be thoughtful as far as the design that you use. It's an opportunity. Every touch point of which we send something out and communicate with a member is an opportunity to create a relationship with them. So make it meaningful and make it engaging. Tailor that communication. Right? There may be multiple ways that an individual can have access to more information about transportation or about that supplemental benefit. So use a prioritized list around what's most valuable to that individual. Use different visual aids, right, to be effective in that messaging and really draw attention. Use QR codes, right, to be able to help drive individuals into where it is that they can find more information about the supplemental benefits, where they can sign up for, right? Help them in order to be able to make it as clear and concise on where they can go to access these supplemental benefits. But keep it simple, right? Make sure that you're using the appropriate reading level, use designs that break up and don't, it's not just all text. Like I said, incorporate the QR codes. And convenience is critical, right? But 65% of insured adults in the US expect a more convenient experience. Some prefer to be print, some want to be directed to their portal, some want an email, some want text. Right? But what's really critical is the really drives engagement is the QR codes. And one of the things that we have is a unique, we call it Pathfinder. It's a unique QR code by member, which we know specifically the actions that that individual has taken and can point to a very specific really landing page or spot for that individual to go based upon that QR code. We know who's interacting in what way. So bottom line here is, I know that things come up quickly and we tend to do what we need to do just to meet the requirement, but don't let this pass up an opportunity to really use that engagement and think it through. We do have the time now. Now's the time to do it. Let's start thinking about how to create as an engaging of an opportunity with members while still meeting the requirements from CMS on this. So if we go to the next slide. So again, right, we can absolutely help without a doubt. We can do the personalization at scale. We can help drive that overall experience. The timeframes are not a problem. We have significant volumes that we do during all year round. We can take any type of data file in any type of format from you, and we can make that work. And we can create those dynamic designs with variable data that we receive from you. We have a team of engagement experts that are just ready and waiting to be able to help you to meet this needs and to make this a very engaging experience for your members. We have guaranteed SLAs with the time requirements and timeframes so that you don't have to worry about not being able to meet the timelines, whether it's for utilization management or for the unused supplemental benefits. Easy to access reporting, which is critical. And then all channels, right? It's not just the print and the email and text, but it's also the APIs and integrated into multiple different portals and different systems our clients have. So we would love to be able to help you with this without a doubt. So we know that we can create a solution that works for your members and you and CMS. So why, again, why does it all matter? Well, supplemental benefits are absolutely underutilized. They can help individuals with their quality of life. And so it's a new requirement that's coming. We're going to all have to do it. None of these don't look like they're going to change. Who knows? There's a lot of change going on right now, but right now these are requirements and these are the dates that are in place. And so don't wait. Get on it right away so that you make sure that you're making the most of this opportunity that you can to touch your members. So with that, next slide. Yeah, final thoughts. Well, I won't make that last too long. I have a lot of final thoughts, but let's just say reach out. Would love to help you. If not us, it's good luck on being able to really meet the timelines with a solution that works for your members, but reach out and we'll be more than happy to help you in any way we can. And we'll keep posted too on any of this if it changes, because we know there's a potential for it, but also have to plan for the fact that it is going to be going into effect. So with that, do we have any questions?
No, I'm back.
Hello, Maria.
Yes, I did see a couple of questions that came straight to me. And I have actually a question of my own. As a good Spaniard, I have never been on time, and I'm sure that our friends on the call have all their ducks in a row. But do you think, or can we assume that we can apply for maybe some extensions if we are not going to meet the, the January 1st deadline next year?
Not that we are aware of, that we have seen. So I definitely would not count on any extensions there. Now, there is always the chance, as we all know with CMS, that things may get delayed. But these final rules, when they come in place, it's you can pretty much bet on them. So don't wait. Rather to
All
be
right.
prepared, prepared for it, or versus hoping that it's going to change and then scrambling to try to come up with a solution.
Beautiful. Sounds good. Another question. What do you think are some of the biggest hurdles insurance and providers face when implementing these new changes?
Mm. Well, like I said, the data for the unused supplemental benefits, the data is absolutely going to be a challenge. We know that anytime pulling new data extracts, can take a while for getting the technology resources. It could be multiple systems if this is in, it could be just one. And then being able to have a vendor who can handle any of those data sources that you trust and that you're going to feel confident are going to be able to meet the turnaround times as well, because there are some utilization management has some short turnaround times, as does that 1 month time period for those unused supplemental benefits. So those are going to be some challenges, and so that's why it's a rather start now, so that if any of those, there's always something that comes up, right? Something that wasn't planned, wasn't expected in the data pull. So start early so that you can handle any of the surprises that may come up.
Beautiful. Another question just got loaded. Is the requirement for all supplemental benefits offered?
Yeah, that's right. All supplemental benefits offered for Medicare Advantage that are unused, completely unused. So just think about just pulling the data for every single supplemental benefit and being able to know whether or not there was any utilization of it, and then pulling that along with the information around copay deductible for each of those listed in the communication for supplemental benefits. So that it's a big process for sure.
And on that topic, can you tell me a little bit more about how Clarity has a plan to support customers for 2027 UN changes, maybe on APIs?
Yeah. So that API is going to also be a big one, and we already integrate all of our any of our communications through APIs, and they go into portals, they go into customer service reps applications. We can integrate those APIs really anywhere. It usually what happens is the challenge or barrier is more on the client side, right? So that's, again, make sure that you've got resources that are now looking at the API, because that's going to be a large lift. So we already do it. We already have the API, so it's just a different information to be providing back. And if we have the information around doing the utilization management notifications, we can use that same information around denial, around reason, and denial reason, and send that via API as well to wherever we need to send it to, provider, member portal, wherever. So love
Beautiful.
to talk through more with individuals and just workflow it out, because like I said, the longest pole in the tent is going to be the data, getting the data extracted, and then making sure who you're working with can handle any of those formats in the time period that it needs to be communicated with the volumes that's going to be required.
Beautiful. Well, thank you. I don't see any more questions on the chat. We want to give maybe 10 seconds to everyone just to ensure that we cover all the questions. In the meantime, I just want to remind everyone on the call that I'm going to post all the presentation and the recording in ACHP Connect for those of you that are ACHP members. I will also send the presentations and recording tomorrow morning to everyone. So or friends that are not a CHP member can also receive the PDF and the recording. But yeah, it looks like we are good to go. Thank you so much, Eileen. Thank
Wonderful.
you so much,
No, thank
Clarity.
you so much.
This
Thank you
was
so much. And
very
yeah,
a lovely, lovely discussion. And if any of you would like to be in touch with Eileen or have any further questions, you feel free to reach out to me at M Velasco, my M from Maria Velasco at achp.org, and I can put you in contact directly with Eileen or friends, Clarity. But yeah, feel free to disconnect. Thank you, Eileen. Talk to you soon.
wonderful. Thank you so much. Take care,
Thank you.
everyone.
Bye.
Bye.